Based on your success, are there any learnings that you would like to share with us?
Basically, it's a success for converting the patients from corona positive to corona negative. Real success will be these patients become, as two have already become totally asymptomatic and get discharged from our place. The third person is still getting oxygen and is not in a good position. And the fourth patient has recently come to our institution, and he's a son of doctor, and he came from the Spain, and just we have started treatment to them, and of course that he will also come out. This is success, is because of the whole of our team discussed it very well, and we could come to a conclusion that as such there is no proven drug for this, so there is no harm in starting this drug, and it was by the grace of the God we got the response.
So we heard that 6 states have asked you to share your treatment formula. Is this true, and which are the states?
Not only to me, to our principal, Dr. Bhandari, our nodal officer of this coronavirus, Dr. Raman Sharma, myself, are getting various calls from the different states by doctors whether we should give these drugs or not. And we are sharing our experiences that because we had no proven drug, we have used it, and luckily we have got the good results also.
So diabetes has been named as among those most vulnerable to the disease. Dr. Prakash, you are a diabetologist who has treated two elderly patients with the disease. What advice would you have to share?
Advice regarding the patient, of course the patient, most of the patients, of course this is a pandemic and going to increase in the near future. First advice is not to be panic. Even 80 to 85% of the positive patients with the milder symptoms get cured without much treatment. Only those 5 to 10% of the patients who are high risk, has severe disease, we have to really take care of them. One is the elderly patients, the other patients who are diabetic, because diabetes reduces the immunity a lot, and they are much less prone for recovery from those infections. And of course, poor lung disease already exists in severe lung disease. So because coronavirus also affects the lungs, destroys the lung, so their recovery is poor. Those persons who have low immunity, they should be taken care well, like those patients who are severely ill, severe kidney disease, severe liver disease, or even HIV infections. So these patients should be taken care well. So only then we can make out of this disease.
So finally, as India's COVID warriors, can you share your views on the disease, the do's and don'ts, and the steps the world is taking to handle the outbreaks?
Yes, that is the most important one. We don't have to be panicky. Second, more important, be more cautious. Don't go to a places where there are rush. Don't go to attend any meetings where there are big number of the persons, marriages, lawns, malls, and even to the temples. We should not get together, get together there. We should not go there. Even the schools also, there should be precaution should be maintained that any children with the fever or cough should not be allowed to come to the school. And for the general public, it is not required to wear a mask. Rather, it can produce some breathlessness, and putting your fingers close to the mouth can also put infection in the mouth or in the nasal cavity. Rather, mask is required for those persons who have developed cough or runny nose. They should wear the mask so they can prevent from spreading it to the others. So these precautions are must. At least any person who is having cough, we should have a distance of at least 2 meters so that there will be little risk for spreading. And a number of myths have come that we should stop taking non-veg. It can spread through this. There is no such proven evidence for this, and you can take eggs or chicken, whatever you like. Rather, it gives you a good protein. There is no need of stopping this. Some myths are there that start taking alcohol, it will stop virus. So again, there is no proof. We should not go, and we should not also spread this kind of the rumors. and we should take precautions to maintain a distance and isolation.